Hi, Dr. Eric Thomas for Nutmeg Dermatology, talking today about Pityriasis Rosea. Well, there's a name for you. It's not rare. It is more common in the 20s, the teens, it could be into the 30s. We're not sure of the cause. One theory is that it is the way an adult responds to a virus that most people have had as younger individuals, as children. What are those endless viruses or infections that produces a runny nose but no rash in a kid? But if you haven't had it, this is the theory, if you haven't had it, then when it does occur, you get a rash. The rash is a little bit more common in the fall and the spring. It certainly tends to be a little more likely to occur in institutions, schools, and so forth, but it also could just be a random one-off. We suspect it's an infection because, and I've seen this happen, sometimes two people in the house will have it at the same time. That would make sense, it's contagious, and yet most of the time that's not the case. Most of the time it's just individuals who get it. So what happens? About a third to a quarter of the time, people develop one spot called the Herald Patch before the major rash. Sometimes, a week or two before the Herald Patch, there's a little sore throat or cold or some minor sign that you're coming down with something. But again, that doesn't usually happen. The Herald Patch generally is a little larger than most of the others that later show up. It can be, about that size, bigger, smaller, often a little oval or circular. It's often thought to be mistakenly a fungal or ringworm infection. Difference is that it's not itchy, it doesn't usually have any scale, but anyway, people come in all the time who've been going to a walk-in or something, and they come in with an antifungal cream, which doesn't do anything, of course. The color, it's said to be a salmon color. Salmon's sort of a light pink, definite pink, but it is a characteristic color once you've seen it. Anyway, if you develop the Herald Patch, then after anywhere from a few hours, usually it's a few days, it can be a few weeks, you develop the major rash. Or the major rash could just show up, de novo. The major rash consists of, again, the same color, rash, a little salmon colored. The spots are discrete. In other words, they don't generally run into one another, though they can be adjacent. And they're usually oval, or here's the key, they often follow the lines that the skin likes to wrinkle. For example, under the arms, you can see the long diameter running sort of in a straight line. They usually are just from the neck to the upper thighs, and they tend to go away after anywhere from 1 month to 5 or 6 months, and usually go away in the same order in which they came, sometimes producing a scale in the center and expanding out. Treating it. Well, it's important to make sure we're not missing anything, and there are certain infections that require a blood test, so it's kind of important to see a doc about this. That can be confused with certain other conditions that are contagious and are more serious, that are called the great impersonator. But I'll leave that between you and your doctor, but please do be sure you don't have any contagious conditions, internal contagious conditions. Now, as far as treating it goes, sometimes a rub-on steroid cream will help. It's worth a try. We usually try to stay away from internal prednisone, though if it's itchy, and although rare, it certainly can be itchy occasionally. Sometimes, rarely, that's necessary. Very light sun exposure sometimes seems to make it go away faster, but since it is pretty self-limited, And assuming it's Pityriasis rosea, there's no particular danger to others. We don't usually have to treat it at all. Anyway, I hope that helps you a little bit understanding what's going on if someone gives you that diagnosis. Best wishes, take care, Dr. T, Nutmeg Dermatology. Bye-bye.